change today. I'm going to make sure that I follow my GPSBs, 11 writes and 3 checks. I'm going to make sure I use 2 patient identifiers to identify my patient. I'm going to make sure I identify myself and explain the procedure to the patient prior to doing it. So the first thing that I'm going to do is make sure that me and my patient both have a mask, which my patient does. So, I am then going to go ahead and open up my sterile supplies that I'm going to need for later in my skill. And then I will just slightly open this. I'm going to perform hand hygiene. And put on some clean gloves. And now I'm going to remove the old dressing by with stabilizing the catheter, and I'm going to remove the old dressing. Making sure to go around the edges, first pulling off the part at the insertion site last. And then disposing of that. Now I'm also going to take off my gloves, and now I'm going to apply sterile gloves. So I'm going to perform hand hygiene. And apply my sterile gloves. Now that I have my sterile gloves on, I'm going to be working out of my box using sterile technique. And I'm going to first clean the insertion site. I'm going to do it in circular motions, making sure not to go over the same spot twice. So clean that. And dispose of that. And then once I dispose of that, I'm going to go ahead and sterilely put on a new dressing. Okay. Now that I have applied the new dressing, I am now going to flush and check all of the forgot the name of those. I did not touch it just then. I forgot the name, but we're gonna check the lines. I would check all of the lines, but today for the video, I'm just going to be doing one at a time. So I am going to go ahead and take my saline. And I'm going to go ahead and prep that. I'm going to leave that in the packaging so it stays sterile. I'm then going to remove the old cap. And I'm going to clamp. I'm now going to take my new sterile clamp or cap and attach it. I'm going to unclamp. I'm now going to insert or inject a little bit of normal saline. I'm going to inject a little bit, then I'm going to aspirate to make sure that I have blood return. If I have positive blood return, then I'm going to go ahead and continue to inject using the push pulse technique. Once I have finished giving all of my medication, I would then remove, dispose, and then I would make sure to clamp. I don't have any of the disposable green caps, but I would apply one of those to the end, and I would make sure to assess my patient during all of this to make sure that they took the medication okay. I would then remove my gloves and I would report and record everything that I have done.